So why are you here today?
I haven't been feeling very well recently. I've been feeling very tired, and my knee joints have been very achy and painful. The nurse said that I had a fever, and a couple weeks ago, I noticed a strange rash underneath my arm, and it was kind of shaped like a bullseye, almost. That's pretty abnormal.
Well, initially what's coming to my mind is Lyme disease. I mean, on the East Coast, that's very common, especially this time of year.
As shown by the map, the Northeast and even Virginia have had thousands of total Lyme cases between 1990 and 2008. Lyme is most prevalent in late spring and early summer months.
Have you been outdoors more than usual lately, or can you tell me a bit about your history?
Not too long ago, I went and visited some family up in Connecticut, and we went on a hike through the woods, and we walked through some very tall grass.
Did you notice any ticks on you when you came back? The main concern is the deer tick, which is it's smaller than the dog tick. It's like most people can't even find them.
Deer ticks are very small, approximately the size of a poppy seed. Lyme disease is normally obtained from infected deer tick nymphs. Due to their small size, nymphs are easy to miss and can go unnoticed for days.
You know, now that you mention it, I think I did find one the next day underneath my arm, around the same location of the rash.
Then that sounds very much like Lyme disease to me. When it ticks on you for around 24 to 48 hours, from its abdomen, it can release the bacteria Borrelia burgdorferi.
In order for a person to get Lyme disease, a tick must be attached for 24 to 48 hours. This gives the tick enough time to transfer the bacteria from its body to the blood of a human. Not all ticks carry the bacterium. A tick must first feed on an infected host, normally a mouse or other rodent, before it can transfer B. burgdorferi to another animal.
And basically your body will respond with a non-specific immune response. And this can cause fever, fatigue, soreness, and inflammation.
More serious symptoms, common with that of stage 3 Lyme disease, appear months or even years after the infection. These symptoms include muscle weakness, numbness or tingling, speech problems, and cognitive problems.
And neutrophils and macrophages will secrete pyrogens from interleukins and interferons, and this will cause the hypothalamus to release prostaglandin, and that will cause fever, swelling, and inflammation.
When the tissue is exposed to the bacteria, a certain type of leukocyte called neutrophils will begin phagocytosis to kill the bacteria. Neutrophils and other macrophages will also secrete endogenous pyrogens called interleukins and interferons. These pyrogens cause the hypothalamus to release PGE2, resulting in an increase in body temperature. One way the hypothalamus does so is by releasing norepinephrine via the sympathetic nervous system onto alpha-adrenergic receptors on blood vessels, causing them to contract. A fever is the body's attempt to denature proteins to slow down the invader.
And this bacteria is also a spirochete, so when it migrates, that forms a bullseye rash, which you noticed on your arm earlier.
The bullseye-shaped rash is a common symptom of Lyme disease. It is a result of spirochete migration, which occurs via the lymphatic system. The rash is normally present 3 to 30 days after the initial tick bite. This inflammatory reaction is normally present before any significant antibody response occurs. Inflammatory responses are caused by an increase in blood flow to a specific area so that immune cells can get there faster and in higher numbers.
Lyme disease spreads through the bloodstream to the joints, the heart, the nervous system, but from what it sounds like, this is still the early stage, so since we're catching it early, hopefully that won't be a concern. And we're going to diagnose this by a blood test and running an ELISA first. which is basically going to screen for the presence of the antibody, and then the Western blot, which will confirm and characterize the specific proteins of the antibody.
Testing for Lyme disease uses a two-tiered system, beginning with an ELISA test, or an enzyme immunoassay, and ending with a Western blot. An ELISA test works by testing for specific antibodies. Antigens are stuck onto a plastic surface. A sample of the patient's serum is added, and Lyme disease antibodies will bind to the antigens. A second antibody with a marker is added. This second antibody has an affinity for the Lyme disease antibodies, so they will bind together. When the appropriate substrate is added, it will react with the marker and cause a change in color. That would conclude that the patient is positive for Lyme.
And treatment will be 14 days of doxycycline, which is an antibiotic that will be used to kill the bacteria.
Doxycycline is lipophilic and can diffuse through the lipid bilayer of bacteria. Doxycycline can bind to the bacteria ribosomal subunit and block the binding of aminoacyl tRNA to the A site of the ribosome RNA complex. This binding will inhibit the bacterial protein synthesis and therefore prevent cell growth.
And for prevention, when going outside, especially on longer hikes, try to wear longer clothing and limit exposed skin, and also consider bug spray and use daily tick checks when you come in.
Okay, thank you.
The only way to prevent Lyme disease is to prevent getting bit by ticks. There are many ways to protect yourself, like wearing long-sleeve shirts and pants tucked into your shoes. Wearing light-colored clothing also makes it easier to see if there are any ticks present. And even if you use these precautions, one should always check for ticks after spending time outside, paying close attention to under the arms, behind the knee, and around the waist.